Okay, so usually we do need 3 images for an ascending uretrogram study. First, one Scott image before doing the injection. Then an AP view while you can see the whole length of the urethra. However, the bulbous part is curved and you cannot clearly see it in the AP view. So we do need an oblique view, no matter left or right. I suggest you to turn the patient toward yourself and take another X-ray. As you may notice from the image, you need to pull the penis so you can clearly see the whole length of the urethra. Let's see what items do we need.
And we do this in patients who are concerned for traumatic rupture of the urethra. Stand on the patient's right side wearing a lead gown, plastic apron, sterile gloves. Have your radiographer stand on the patient's left-hand side with the X-ray tube angled at 45 degrees towards the patient. Put the plate underneath. Have the lower strap of the pelvic binder undone. Use a sterile feel as you would for any urinary catheterisation. Draw up 60 ml of contrast. We use Omnipaque. Use a 12 French catheter and prime it with the contrast so there are no bubbles. Leave the syringe attached. Insert the catheter into the meatus 3 centimetres. Gently inflate the balloon up to 3 mils or up to the point where the patient experiences discomfort. Pinching the glands to create a tight seal, slowly instill 20 mils of contrast. Be careful to mop up any leaks to avoid artifact on the X-ray. Apply gentle traction to the catheter laterally to move the penis into an oblique plane. Move your hand out of the way and take the X-ray.
Take a scout KUB of the patient's abdomen in the supine position with a field of view including the kidneys and bladder. This is an example of a KUB image.
Place a Foley catheter into the patient's bladder if not already present. Hang the cystograph in contrast 3 to 4 feet above the table, typically on an IV pole. Ensure that the tubing from the bag of contrast to the Foley catheter does not go below the table. With the patient in the supine position on the fluoroscopy table, fill the patient's bladder with contrast.
Bladder volume of adults varies. Tailor your examination to the patient. Most patients tolerate 300 to 400 milliliters of contrast, while in postoperative patients, 150 milliliters is typically sufficient. Collimate the field of view to focus on the bladder to prevent unnecessary dosage to surrounding structures. Intermittently fluoroscopy the patient's bladder as contrast is filling it.
Jadi untuk pertama-tama kita bersihin dulu area vitalnya dengan menggunakan alkohol. Setelah itu kita lanjut dengan menggunakan betadine. Setelah menggunakan betadine, jangan lupa diberi jeda terlebih dahulu. Lalu kita oleskan seluruh kateter. Habis itu kita masukkan perlahan-lahan sampai di Sistem Urinarianya. Setelah itu kita beri belenggu. Belenggunya cukup dengan 3 cc saja.
This is the LPO position. This is an image of the bladder in the LPO position. This is the RPO position. This is an image of the bladder in the RPO position. This is the AP position. This is an image of the bladder in the AP position.